Hello all, hope all is well. So today we're going to talk about blood pressure medications. Did y'all know that the United States of America prescribes the most pills in the world? And I'm talking about, pills from blood pressure medications all the way down to opioids. The United States is on top of the list. No other country is prescribing drugs the way the United States of America is, because no other country is as consumer driven or money driven like the USA. And really, over the years, whether it was in passing or in direct communication with someone, I've always heard people talk about their blood pressure medications, how many they were on, their side effects, what their doctor's name was, how often they needed to go to the doctor's offices, their dosage amounts, just everything pertaining to blood pressure medication. And in the back of my mind, it was always a question of why do we rely so heavily on the medical field and medical professionals to tell us what our body needs when we don't need this stuff? Why do we need to continually go to the doctors? And why can't we do the research for ourselves to see what our body actually needs holistically? So now it's time to get off of those prescription medications. It's time to leave those doctor's offices alone. And I could give you a few reasons why. So we're going to go ahead and walk through the blood pressure medications, not all of them, because there are way too many to name. And I don't even understand that. Why in the world do we need 30, 40, 50 types of blood pressure medications manufactured by 10 to 15 different pharmaceutical companies? I mean, how much money are they really making off of us, guys? I come up with a list of 10 medications. And to be honest, it kind of gets repetitive after you talk about the first medication, because they all have the same side effects, or at least similar side effects. Number 1 is Lisinopril, which can cause fetal toxicity if you are pregnant. It could harm your unborn child, swelling of the legs, lips, tongue, throat, intestines. I've never heard of a side effect that would swell your intestines. Okay, changes in your kidney function, your increase in potassium, which could lead to liver failure or kidney failure too. Also, jaundice or yellowing of the skin or eyes, headache, dizziness, cough, laziness, like lethargy, not wanting to get up, very tired, chest pains. And the long-term effect of this drug, and basically every drug that I'm going to list, is the exact same. And it is that your heart and your arteries may not properly function. And also, it may damage blood vessels of the brain, heart, and kidneys, resulting in a stroke. See, this is the fine print on those commercials that they tell people when they're trying to tell you about a prescription, like, here is Lisinopril and these are the benefits. And here at the very, 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 very bottom, when the lady is talking real fast at the end, that's when she's telling you all of these things listed on the side effect sheet. Matter of fact, I saw the other day there was a guy that was going through a prescription booklet that he had. And one of the prescriptions that he was on had at least 10 pages of side effects. That's how many things are happening in your body. That is the reaction that this pill, this chemical, is giving to your body. So you can only imagine what the rest of them are doing if we're starting at number 1, just like this. And Lisinopril can give you a high potassium, which can lead to heart rate and also heart rhythm problems. I know that I was looking at something and this lady said that she had to wean herself off of the blood pressure medication because of the side effects. They were getting so intense. So the fact that you have to wean yourself off of a medication should tell you a lot. Number 2 is Lapresser. And let's just say Lapresser is Lisinopril times 1.5, because it's basically the exact same side effects with a few added, like slowing down your heart rate. It causes hypertension, which is the reason why you're taking it. So it just doesn't even, okay. Tiredness, dizziness, depression, mental confusion, short-term memory loss, headaches, shortness of breath, insomnia, palpitations or irregular heartbeats, allergic reactions, and also the same long-term effects as lisinopril. It also lists blurred vision, weakness, bloating, swelling, chest tightness, decreased urine output, hallucinations. I mean, you could go on and on and on with the side effects because it was at least 100 listed off of one pill that's supposed to help you. In return, it's really hurting you. And to name a few of the very rare effects, but I don't think it's too rare if they had to list it too, but itchy skin, ulcers, abdominal pain, and clay-colored stools. Yeah, guys. Number 3 is Amlodipine or Norvasc. Now, I've heard of this, but not as often as the first two. And its side effects include kidney disease, weight gain, and a very high potassium leading to an irregular heart rhythm. And really, it's the same thing. It could also cause upper respiratory infections and more adverse reactions that wasn't even listed. So you can only imagine how many real true side effects this medication has versus the others. And what's interesting is that 3 out of 5 of these prescription medications that I'm talking about were recalled within the past 3 to 5 years for things unknown, so they say. But from what I could see, it was because of the manufacturing errors. And number 4, Lozartin. Lozartin. Hope that's right. But yeah, number 4, blurred vision, difficulty breathing, dizziness like the other ones, nausea, vomiting, high potassium that can be found in your blood levels, which could lead to heart rhythm issues, low blood pressure, kidney disease is on this side effect list, weight gain, allergic reactions, swelling of the face, throat, tongue. Do y'all know that if y'all's throat and tongue swell up, that could be fatal? Just saying. Back pain, low blood sugar. And that just reminds me that if this medication gives you low blood sugar, right? And you go back to the doctor and you tell them, hey doc, I'm having some low blood pressure and low blood sugar issues. Now they're liable to prescribe you something else because you're having a side effect from the first medication. So now because you're having that side effect of low blood sugar, they're going to prescribe you a second medication to combat that low blood sugar. Now what's going to come out of that second medication? Going into number 5. Hydrochlorothiazide has been recalled over 5 times within the past 3 years, y'all. That should tell y'all a lot. Either way, it causes low blood pressure, tingling in your muscles and in your body, muscle spasms, diarrhea, mouth sores, fever, skin rashes, skin peeling, shortness of breath, confusion, abnormal heart rate, and inflammation of the pancreas. Inflammation of the pancreas. Same thing with the low blood sugar. See, now since you have inflammation of the pancreas, you got to go and get on another medication. But see, if you get to the root of what's going on with your blood pressure, you won't have to worry about all of this. So same thing with the long term. Each one of these medications have the same exact long-term effects on your body and in your blood vessels, in your brain. That's scary, especially for people who have been on these medications for years and years and years and years. And by God's grace, you're still here. You're still here. And I hope that, this video helps you to wean yourself off of those medications even more, because it's vitally important. And to be honest, these meds are only masking whatever is going on in your body. It's not getting to the root cause of what is wrong with your blood pressure, because it could be something you're putting in your body. It could be your environment. It could be something just as small as you are eating a little bit too much of this. But you wouldn't know because, you know, you'll go to the doctor and they'll put you on something to make you feel like you have to have this medication. You know, when the last time I went to the doctor a few years ago and they tried to tell me that I needed to take something and I had to tell them no, you know how much pressure they tried to put on me to get this prescription pill? You know, and I had to continually tell them, no, I don't want that. I said, I'm going to go home and look up the natural ways to heal whatever it is you just tried to tell me I have. You know, so they literally will push these meds on you. Look, let y'all in on a secret. They push these meds so heavily so they can get paid off of it. Okay? That's just like a car salesman trying to get you in that car that you don't need or don't want. They're trying to get a commission. That's pretty much all it is. So you may find a couple doctors out there, a couple holistic doctors out there that really actually care about your health. If that's the case, they're not going to be trying to prescribe you any type of chemicals like this. Now, 6 through 10 on the list were Coreg, atenolol, aldactone, furosemide. I believe that's right. It starts with an F, ends with a mide. Furosemide. 10 is chlorodyne. So all of those, the top 10 blood pressure medications. And with the 6 through 10 that I've listed and haven't really talked about the side effects, it's because it's the same. It's the same. All of them have the same side effects. And the only thing that's really different with the 6 through 10 is, let me see. The two that stand out is heart failure with the Coreg and changes in hormones with the aldactone. That will actually change your hormones and change your menstrual cycle. And that's the last thing we need going into our bodies because you already know once that happens, then you have to get on something else. It's like a cycle, y'all. They keep you going to the doctor's offices, don't they? They do. They know how to make money, whether it's through you or through your insurance companies. They know exactly what they're doing. They were trained to do it. So hopefully, and I do hope that this video helps somebody who is either trying to get off of medication or is thinking about it or whatever. Get off of those medications, y'all. There is something better at the end of the tunnel. Trust me. And I've already talked about, you know, beet juice and how that can lower your blood pressure if you have high blood pressure. Granted, you do not need to drink a lot. And you're going to feel that instant relief. You can tell when something is truly working in your body. So you just have to, you know, be mindful with everything that you take and every, you know, adventure or whether it's herbal supplements or not, be mindful of what you're taking, you know. There is such thing as too much of a good thing too. So just knowing that you need to get off of the medications is the number one tip that I would like to give. These medications do not work. These doctors, majority of them, don't even know what they're prescribing, y'all. And it's a sad society, truly, you know, when they can just hand out prescriptions like it's candy. So get serious about your health, get serious about getting off of these medications. And like I've said before, they tell you not to stop these medications abruptly for a reason. So they can keep you on it, you know, and scare you into thinking that you have to have it. And that is not the case at all. Wean yourself off of these medications so that your body can get acclimated back to its normal regimen. And then try the herbal supplements. Try to change your diet up. Try certain things that are going to help your blood pressure and eliminate anything in your environment that you can eliminate that is not helping you at all. Thank you guys for watching. I hope you have a great rest of your week.